Good evening, everyone. Welcome to Gyaan Vardhini Webinar 08. Can we just wait one more minute and then we can continue with this ahead? Good evening, everyone, and welcome to Gyaan Vardhini Session 08. I am Aarti Mishra from Team ClinSav, and it's truly a pleasure to have each one of you to join us today. A very warm welcome to all the esteemed participants for the Gyan Vardhini session, and it's my honor to have you all here as we embark our another enlightening journey of wisdom and knowledge enhancement. Before I begin, I would like to brief overview about ClinSav application. ClinSav is a comprehensive clinic management application designed to streamline and optimize clinical practices for doctor. It also offers a huge range of features that enhance the efficiency and effectiveness of clinic operations, ensuring that healthcare providers can focus on delivering the best care to their patients. Today's webinar topic is an Ankylosing Spondylitis, an answer by Ayurveda. A subject that holds a significant importance in the realm of holistic healthcare. Our dignest speaker for today is Dr. Hetal Shah. She holds a BAMS degree, having graduated in 2007 from KGMP College, Mittal College. With 14 years of clinical experience, Dr. Shah specializes in the management of lifestyle disorders, metabolic conditions, and dermatological issues using Ayurveda principle. Currently, Dr. Shah is associated with Ayurvedic clinic, where she continues to make steroids in promoting Ayurveda healing. Welcome, Dr. Hetal, ma'am. Over to you. You can start up with the webinar.
Yeah. Hello, everyone, and a warm welcome to you all. Today's topic, I'm sure every one of you must have heard of this disease called as ankylosing spondylitis. And you must also be aware of the fact that there is no definite cure for this disease as per modern science. So, in today's session, we'll see the Ayurvedic management of ankylosing spondylitis, understand the disease under the lens of Ayurveda, and see a wonderful management of this disease by Ayurvedic drugs. So let's begin today's session. Next slide, please. Yeah. I would like to dedicate today's session to respected Dr. Devchand Gala sir and his guru Rajvaidya Krupashankar Bhattji, as well as my mentor and guide Dr. Hima Nanavati. Whatever limited knowledge I'm going to share today is all contribution of my great gurus. Moving on to next. We will proceed the today's session as in we will look the introduction of ankylosing spondylitis, understand all the modern aspect in terms of its sign and symptoms, pathogenesis, investigations, a case study and then correlate it with Ayurvedic aspect, treatment protocol, drug use. Finally, see the conclusion in terms of cure or remission. So let's start with the introduction of today's session. What is ankylosing spondylitis? Ankylosing means stiffening or fusion. Spondyle is spine and itis is inflammation. So simply, this is a type of arthritis where there is stiffening or fusion of the spinal joints due to inflammation. Now, the most commonly affected joint is the SI joint, also known as the sacroiliac joint, the joint between the bone sacrum and ilium. Next. Okay, a couple of words are associated with this disease. As it is said, ankylosing spondylitis comes under a chronic, that is, it is long-standing. It is seronegative. Here, the RA factor in the blood is negative. Now, this is important as it gives us a differential diagnosis between rheumatoid arthritis and ankylosing spondylitis, which is AS. So, for rheumatoid arthritis, RA test would be mostly positive, whereas in this condition, RA test is usually seen negative, so it comes under seronegative. Next comes inflammatory, as there is inflammation of the joint, and spondyloarthropathies, as it is the disease of the spine. Now, in chronic cases, this disease causes complete fusion of the spine, leading to rigidity of the spine, also known as the bamboo spine. This shows us the severity of the disease that if unaddressed, the inflammation may worsen to such an extent causing rigidity and fusion of the spine, giving a bamboo spine look, worsening the condition of the patient. So let's see how the progression starts. Coming to the epidemiology, according to the previous report, it was said that this disease has more prevalence in males as compared to the female, where the ratio was 3:1. But now the recent studies show that there is equal prevalence, the ratio being 1:1 in both male as well as the female. So it is equally prevalence in both male as well as female. This disease has an early adulthood onset, that is between the age group 15 to 45, mostly the disease shows its impact. Now, correlation with HLA-B27. It is said that 80 to 90% of AS cases have this HLA-B27 positive. Epidemiology shows that 0.2% of general population develop this ankylosing spondylitis. This shows that this is a rare occurrence. And only 2% of HLA-B27 develop ankylosing spondylitis. An important note over here that every patient having HLA-B27 positive may or may not develop ankylosing spondylitis. But patients having ankylosing spondylitis generally have their HLA-B27 positive. So I repeat once again, HLA-B27 may be found in normal people, and being this report positive does not mean that you have a disease. But if you have been diagnosed with ankylosing spondylitis, generally it is seen that these patients have their HLA-B27 positive. Moving to the next slide. Now, what is this HLA-B27 positive test? This is a blood test which shows the presence of the gene called HLA-B27. Now, the full form of HLA here is human leukocyte antigen B27. What is it? It is a gene which is present on the surface of WBC, and it is a marker which can be detected by a blood test. It suggests a greater than average risk of developing or having certain autoimmune disorders. Now, autoimmune disorders, as you are aware, is a condition where the immune system mystically attacks the body's own healthy body cells. Next. Now let us understand how does the pathophysiology actually occurs in ankylosing spondylitis. So the pathology goes this way, that several genetic as well as non-genetic risk factors. Can you please move the cursor accordingly so that we can just understand it in more detail? Yeah, so first is the genetic and non-genetic risk factors. This along with the gut microbiome alterations, which is shown, the gut microbiome alteration activate the lymphoid cell. Now these lymphoid cells migrate to the spinal tissue and lead to the activation of cytokinins intraleukin 17 and intraleukin 22. As you can see, the lymphoid cell migrating to the lymphoid tissues, spinal tissues, and there these cells lead to the secretion of IL-17 and IL-22. These are cytokinins. Now, these cytokinins, along with TNF factor alpha, that is the tumor necrosis factor alpha, is responsible for the inflammatory condition which sets between the in the joint tissues. Now, along with the mechanical stress and all this inflammatory response, the progression of the disease occurs. Now you wonder, where does HLA-B27 come into picture here? Now, HLA-B27 is researchers show that is actually linked for altering this gut microbiome alteration. So this was the relation between HLA and ankylosing spondylitis, where it actually alters the gut microbiome, consequently leading to the inflammatory process in the spinal joint tissues. Next. If my speed would be fast, you can let me know in the chat and I can accordingly slow down. Yeah, so we'll just continue. So according to the rate of this inflammation, there are several stages in ankylosing spondylitis, where there is stage 1, which is called as an inflammatory stage. As we saw, there is activation of cytokinins. Next comes the stage of early disc calcification. Now, as this inflammation stage continues, there is damage in the spinal tissue cells and there is calcification in these tissues. Next is the stage of fibrous ankylosing. Here, the damaged tissue is replaced by fibrin, which causes the limitation in the joint movement. So, whenever we see a patient with joint mobility disorders, definitely the fibrin stage has been reached in those patients. And finally, the stage 4, which is the stage of bony ankylosis, where osteoblasts are activated and there is complete ossification of the joint, leading to the condition called as the bamboo spine, where there is complete fusion of the spine. Next. So now what are the symptoms in this disease? So axial skeleton is mostly affected. So axial skeleton meaning the skull, neck, and the vertebrae, these are the mostly affected part. The most common symptom which is presented is prolonged morning stiffness along with mid and lower back pain. Now this pain is inflammatory in nature. Now how can we differentiate between an inflammatory pain and a mechanical pain? Generally, in a mechanical pain, the morning stiffness is less than 30 minutes. But if the morning stiffness is more than an hour, then it definitely suggests that the pain has some inflammatory origin. Also, this inflammatory pain has, the pain is more in the night and it improves with exertion. Whereas these patients will say that they feel sacroiliac joint. So there is pain. This usually presents as pain in the body.
Dr. Hetal, there is some kind of glitch at your end. Can you just check it once?
Area. This is mostly the first
Dr. Hetal, am I audible to you? I guess there is some kind of internet issue at Hetal ma'am's side. We can just wait for 2 minutes.
Extremely sorry, everyone. There is some technical issue from the Dr. Hetal's madam's computer. She is just logging out and logging in a few minutes. Hold on for a few minutes now. जो है तो कैमरा बंद रखो.
Yeah. Is my voice coming?
Yes, it's audible.
Am I audible now?
You're audible, ma'am.
Yeah. Yeah, the voice is clear.
Yes.
Hello, is the voice clear?
Oh, yes, Hetal ma'am. Your voice is clear.
Okay. So I guess we need to start as some things have been missed. So should we start from the symptoms? Dr. Snehal?
We need to repeat this slide again, ma'am.
Okay. Yeah. So we will start with the symptom slide. Yes. So the most common symptom of ankylosing spondylitis with the patient present is of the prolonged morning stiffness. There is mid to lower back pain, and this pain is mostly inflammatory in nature. Now, how do we diagnose whether this pain is mechanical or inflammatory in nature? So usually in a mechanical pain, the morning stiffness is less than an half an hour. That is, it settles within half an hour. Whereas in an inflammatory pain, this morning stiffness can be more than an hour. Also, there is more pain at night, which improves with activity. Now, this is very contradictory to the mechanical pain, which increases with activity. As seen in many osteoarthritis cases, when we say patient complain that due to movement, the pain increases. And over here in ankylosing spondylitis, actually the patient feels better with activity. So this gives us a differential diagnosis between ankylosing spondylitis and any other type of arthritis. Okay, so next common symptom is sacroiliitis, which present as a buttock pain, as there is inflammation in the SI joint, which we saw earlier. Also, along with there can be neck pain. This can be one of the first symptom of ankylosing spondylitis. And with the progression of the disease, we see decreased spinal mobility in these patients. Moving to the next slide. Yeah. Now, what are the extra articular manifestations of this disease? So we see acute anterior uveitis when in these patients. That is, there is inflammation of uvea, there is the layer of the eye. This presents as the redness in the eye. Other systemic manifestations in the term of aortic regurgitation and apical ILD, that is interstitial lung disease. Gut manifestation in terms of irritable bowel syndrome. Also, there are skin manifestations in form of psoriasis. So these are all extra articular manifestations of ankylosing spondylitis apart from the spine. Now, how do we diagnose this condition? So clinically, there is a test available called as the Faber test, where F stands for flexion, AB stands for abduction, and ER stands for external rotation. As you can see in the image, where we generally do the flexion of one of the knee joint, followed by the abduction of the same hip joint of the same side. And then when we do the external rotation of the opposite hip, patient gets a pain. Now, getting the pain confirms that the Faber test is positive. So we can clinically diagnose this condition by Faber test. Other serological investigations include HLA-B27 factor, which will be positive, CBC increased ESR rate, CRP, RA factor, which generally will be negative or positive, and ANA factor. So all these are serological tests which help us for making the diagnosis. Along with these, there are very important radiological tests which confirm our diagnosis, which include, yeah, I just got your message. I'll just finish this off and repeat with the Faber test. So radiological tests include X-ray of LS spine. Now here, when we are suspecting any AS condition and we are asking for an X-ray of the spine, it is very important to include or write with special focus to SI joint, because it is the SI joint where the actual inflammation or the activeness of the disease will be shown. So it is very important to include with special focus to SI joint. Again, same with the MRI of the spine, including special focus to the SI joint. So these radiological conditions definitely confirm the presence of ankylosing spondylitis. Now, moving to the Faber test again, as the name suggests, how is this test conducted? So F stands for flexion, where we do a flexion at the one of the knee joint. Next, followed by abduction at the same hip joint. And when we do the external rotation of the other side of the hip joint, patient experiences the pain. So if there is pain, it suggests that this Faber test is positive, which tells us that maybe this disease is leading towards ankylosing spondylitis. Is that okay? And should I move ahead? Yes. Now let us see the case presentation of today. So the next slide. Yeah, so 33-year-old female presented with a past history of severe back pain. This episode she had got after 1 year of her delivery. This was the first episode she had got of this back pain, which was after 1 year of the delivery, and resolved within a week with hot fermentation. So this was somewhere around 2012 where she had her first episode of this back pain. Now, this patient had a strong family history where her father had psoriasis and brother was suffering from irritable bowel syndrome, as well as RP, that is retinitis pigmentosa. It is an inflammation of retina. Now, this family history helps us to know that there was strong autoimmune pathology moving or revolving in the family. So, next slide, the other symptoms. Yeah, next. So in July 2018, this patient presented with gradually increasing buttock pain, which was shifting in nature. Sometimes it was on the left buttock, sometimes it was on the right buttock. And along with that, there was the shooting and pulling pain in the lower back. She had a morning stiffness of gradation 5 to 6 on 10. Several sleepless nights in term as there was more pain in the lying down position, which was relieved only by movement. So she had maximum pain in the lying down position, that is at the night. And along with that, she had face puffiness. Now in the following table, we can see the gradation of the pain, which suggests that it is maximum in the morning hours 8 to 9, and then as the day proceeds, the pain also came down around to 3 to 4. So 3 to 4 was the persistent pain she had throughout the day. Yeah, next slide. Other examination showed that there was lot of adman, adhovayu. She had a mrudu kosht, that is, there was stickiness as well as inconsistency in her stool. They were semi-solid, and urgency in passing stools. The appetite was moderate. Nidra has said that there were several sleepless nights because uh, she had pain, and due to that pain she couldn't have a sound sleep. Also, she had this RLS, which stands for restless leg syndrome. In the morning, she had more morning stiffness, lethargy, and felt fresh only after passing stools. Now, here we have a very relevant menstrual history in the terms that she had severe premenstrual symptoms. The mood swings were very prominent in such as depression and irritation. The calf pain was maximum during the menses and increase in bloating. Also, there was breast heaviness. Patient presented with all these symptoms. Next. Yeah, so investigations done, as she had visited the orthopedic already, so she had already done all the necessary investigations. So investigations we'll have put some slides of the investigations also, which we will see in the coming slides. So HLA B27 blood test was positive. Her ESR was raised. RA test was negative, as we saw in the earlier slides that mostly these are seronegative, that is the RA factor in the blood is negative. And there was no ANA test, but we have images of the X-ray and MRI of the spine, and let us see how these slides help us to diagnose the ankylosing spondylitis conditions. Yes, the next slides. So in this slide, you can see HLA B27 detected. Yeah. So it confirms that this is HLA B27 positive. Yeah. So now here, this is the image of X-ray spine. The first image shows the spine alignment. You can clearly see that there is deviation in the alignment of the spine towards the right, which means there is spasm in the paraspinal muscles of the right, which has led to the deviation of the spine. Also, you can see the diminished intervertebral space, lot of abdominal gases which are present. In the next pic, which is the lateral view of the spine. Yes. Yeah. So again, over here, we can appreciate lot of abdominal gases and the diminished intervertebral disc space. Also, if we zoom out the picture, yeah, Dr. Snehal, can you just zoom and show, yeah, a little more degree of zooming if possible? Yeah. So clearly, can you show the erosion in the spinous process? Yeah, here in the spinous process of L5 vertebra, we can clearly see that there is breakage in the spinous process, and due to this, there is shifting, anterior shifting of L5 vertebra. Now, this condition is called anterior listhesis, forward moving of the vertebra or riding of L5 over S1. So we can appreciate the pressure which would be in the spine where there is breakage of the spine leading to the anterior movement of the vertebra. I hope you could appreciate what we wanted to show in this slide. Yeah, and the other image is of particularly of the SI joint, where we can beautifully see the left SI joint, the continuity of the joint between the sacrum and ilius bone, whereas on the right side, there is the joint is not clearly visible as there is lot of erosion and inflammation. So this clearly indicates that there is sacroiliitis, confirming the diagnosis of ankylosing spondylitis. So these are the real X-rays films of the patient. moving on to the next film. So these films were taken in flexion as well as extension positions. So in flexion, again, we can see there is reduction in the space. Also, in the extension, due to this listhesis, there may be nerve impingement between L5 and sacrum, which may be the cause of the shooting and pulling pain in the lower back, which the patient was complaining. So somewhere the nerve involvement is there, which is giving the pain, which is of a very intense pain, shooting pain in this patient. Yeah. So for the next slide. Yeah. So these are the MRI images. And to the right side, you can see a zoomed MRI image of the sacroiliac joint, where clearly the SI joint erosions are visible. Yes. So you can see the white patches more prominent on the left side of the sacroiliac joint, and see there is breakage in the joint continuity, whereas on the right side it is a continuous pattern. So this shows there is erosion and inflammation, active erosion as well as inflammation in the SI joint just going on. So these X-ray and MRI clearly indicate some inflammatory pathology and confirming the diagnosis of ankylosing spondylitis. Now, when this patient comes to the clinic, we generally treat the patient according to the modern diagnosis. We definitely get some relief in the patient gets relief in the terms of pain. But do we actually treat the patient considering the modern pathology? No. So here we need to reevaluate the case in terms of Ayurvedic principles and concepts, and then treat the disease not according to the modern diagnosis, but the dosh dushya samurchna which is going on in the body. So now let us have a look at the Ayurvedic perspective of this disease. Yeah. So let us go back to the symptom slide of with the patient had with what the patient had come. If we compare, we can correlate this with the symptoms of Amvat. Now, there are many Vat Vyadhis described in the Ayurvedic test, and looking at the symptoms of the patient, we can definitely make out that this is a type of Vat Vyadhi, which according to the doshas, there were more prominent vikruti of Vayu and Kaf, more precisely Sam Vayu and Sam Kaf vikruti. Now you can see in the symptoms of Amvat, here Trik Sandhi Praveshaka, which we can correlate with SI joint involvement. Also there is Stabdita, referring to the stiffness of the joint, Alasya, lethargy, Gaurav, heaviness in the body, and Apak, as there are a lot of digestive issues. So we correlated this as Amvat, and taking Amvat into consideration, we treated this patient on the guidelines provided according to the Amvat manifestations. So next slide. Yeah, so we are aware of the Samprapti of Amvat. The most common Hetu Sevan for Amvat relevant in today's age is the Viruddhahar. All the junk food which is usually common in the society, pizza, momos are all come fit into the category of Sanyoga Viruddha Ahar, which cause a lot of Agni Mandya and ultimately Am Utpatti. Also, a variety of Viharaj Hetus are prevalent in today's era, like doing exercises in the state of Ajirna or doing swimming in the state of Ajirna. Another common Hetu seen in these days, due to hectic morning schedules, majority of the people opt for going to gym in the evening after having evening snacks. So this one of the Hetu of Amvat has stated in the Grantha, that is Snigdho Bhukto Yanam, that is consumptions of high calorie diet and followed by exercise leads to the triggering factor for Amvat. So both this Aharaj Hetu, which causes Am Utpatti, and Viharaj Hetu, which causes Vat Dosh Prakop, there is formation of Am, and this vitiated Vat carries this Am further into the body, different parts of the body through circulation. The sthana sancharaya of this disease helps in the shleshma sthan, that is kapha sthan, especially the drik and spinal joints, presenting symptoms like sandhishul, shodh, gauravata, stabdata, etc. We'll see the rupa avastha and finally the manifestation of ampat. Yeah. Next slide. Yeah. Now we have seen both the Ayurvedic as well as the modern concepts related to ankylosing spondylitis. And both types of treatment are available for this disease. Let us have a comparative look at the treatment offered by the modern medicine as well as Ayurveda, and then just have the choice of treatment. Now, the conventional medicine aims at treating the disease stage-wise. So, as in the first stage called as the inflammatory stage, in view for the pain and inflammation, non-steroidal anti-inflammatory drugs are available, which help the patient by reducing the pain, but these are only the painkillers and not the cure. So these are anti-inflammatory drugs like ibuprofen, etc. In the more worsening cases, steroids are introduced and also DMARDs are introduced, which are disease-modifying anti-rheumatic drugs like sulfasalazine, methotrexate, which let which help in arresting the inflammatory conditions. In further severe cases, biologics are introduced which help in blocking the action of cytokines. Again, physiotherapy involvement in sense of spine strengthening and spine stability exercises which help in improving the stability of the spine. And in worse conditions, surgery of the damaged joint is there, but this is also very risky. So in general, if we see, there is no definite cure for ankylosing spondylitis according to the conventional science. The treatment only lessens your symptoms and possibly slows down the progression of the disease. Now moving to the Ayurvedic line of treatment. This treatment or this protocol is not only applicable for this condition or ankylosing spondylitis, but this you can apply for any case coming to your clinic. Any XYZ disease, if you go through these keys and if you know where to apply the key to a proper condition, you can definitely get your answer. So we start with internal, Langhan, Deepan and Pachan, and followed by Ampachan. Now this we act at coastal level where we are introducing Langhan or Lagu Ahar, which depends upon the condition of the patient, Deepan and Pachan of the dosha, and extensively Ampachan as there is arm involvement in the Samprapti. Further, external Ampachan is done by Ruksha Swed, and only when this stage is cleared, we go further move to Snehan and Swedan. Now for pulling out the lean dosh from the coast, when we have cleared out with the Koshtagat doshas and we want to move towards the lean Shakhagat dosh, we introduce Panchkarma. This helps to take out the lean dosh from the shakhas and move them to the coast. Finally, we come to Rasayan Chikitsa, which is the Apunarbhav Chikitsa, where we actually break the pathogenesis of the disease. Along with this, we have aid of many postural correction, yoga techniques, pranayam or breathing techniques, and meditation, which definitely help the patient to come out of this condition in a very smooth manner. Yeah, so the next slide. Yeah, move forward. Now let us see the Chikitsa Sutra of Amvat. A variety of procedures have been given in the Chikitsa Sutra. Very important, starting with Langan. Now it depends in what stage the patient has come and we have to decide whether to give for Langan or Lagu Ahar. Now many a times patients are on steroids and they come to your clinic expecting some relief for their condition. So in such cases, we cannot directly start them on Langan as it will worsen their condition more. So in such cases, we generally give with Lagu Ahar. Once the balance is maintained, Then slowly and gradually, according to the avastha, we decide the treatment protocol. So a variety of procedures have been described over here, but it depends according to the stage what procedure to apply where. Also, one of the important point mentioned here is Valuka Potli shake. Now, we know Amvat is a Vat Vyadhi, and wherever we have this Vat Vyadhi, the first thing which comes to our mind is Sneha. But here the Sutrakar in Bhrav Prakash, it has been clearly mentioned that Ruksha Swed is to be applied first. And only Baluka Swed, which has the ability of uh, just pulling out that arm factor, which is in the Sandhi. So initially starting with this Valuka Potli shake is very important, and it is clearly mentioned Sneha Varjita, that we don't have to introduce any Sneha unless the stage has moved further. Yeah, so next slide. So we select the modalities of treatment according to the stages, where in Sama Avastha we go by introducing Pachan, the drugs which help in the Pachan of doshas of arm. So these all drugs are included in Sama Avastha stage. Once this stage moves to Pachyaman Avastha, then we go for Shaman techniques. And the next stage is of Bruhan, which is only and only in Niram Avastha, followed by Rasayan and Vajikaran, which gives us a Apunarbhav Chikitsa. Now, these stages, identifying these stages is very important for helping us know how to apply which drug where. So, as we said, in the stage 1, Pachan stage, we generally aim at Am Pachan. This is done by internal meditation, as well as very important Ruksha Swed, that is Sayan fermentation, or Arka Patra Swed. Now, this Swed is an important, acts like an important painkiller for the patient. So you literally need to convince the patient to do this sand fermentation more frequently as possible, because there is lot of Ama Sanchiti, and by this Ruksha Swed only we can locally give some kind of relief to the patient. So convincing the patient for this Ruksha Swed is very important, and specifically the sand of seashore, Samudra Reti, which has that ability of taking out that samvayu. So the pachan is done by Am Pachan and Ruksha Swed. Next, Deepan, which is aimed at Jataragni Deepan, then Dhatwagni, and then Bhutagni. So first and foremost, Jataragni Deepan is very important, which will be followed by Dhatwagni and Bhutagni. Shodhan in terms of Nasya, where we give good Shunti Nasya, and as and how the stage progressive, we keep changing the Nasya according to the Avastha of the patient. Shodhan in the form of Vaman, Rakta motion. This all depends on the condition, Balya, Satmya of the patient, and only then it is introduced. Next, Bruhan Chikitsa, now Snehan is introduced. So, in spite of this being a Vat Vyadhi, you can clearly see that once Pachan, Deepan, Shodhan is done, only and only when the Niramavastha is achieved, only and only then this Snehan is started. So, having that patience is very important. Will definitely get the result, but a systematically approach to a disease will definitely give us an answer. Again, Bruhan in terms of Basti and Grutpan will help in strengthening the spinal tissue. Apunarbhav Chikitsa with Rasayan and Vajikaran. Also, we do lot of postural correction, yoga techniques and pranayam, which help in strengthening the muscle, and in proper postural correction help to move the doshas more towards the kosht. So there are active poses as well as passive poses in postural correction. Now, what were the drugs used in this particular case? So the first drug, Ajmodadi Churan, which was given in the dosage of half teaspoon with good as an anupan. So why was this? Yeah, I would like to come to the questions at the later. I'll just finish with the slides first. Yeah, so why was this Ajmodadi Churan selected? As it has Shothar action Vatanu Loman, because we have given the Anupan as good, which will further help in Vatanuloman as well as Pachan. Now, when we saw the symptoms of the patient, we saw that it was predominantly Sama Vayu and Sama Kapha Dushti. And Ajmodadi is the drug of choice for this Vayu Kaph condition. So Ajmodadi was the drug given. Along with that, for more Ampachan, we added Agni Tundivati, 250 milligram BD, again acting as Deepan and Vatagna. Mentat tablet for pacifying the Manasic dosh. Maharasnadi Kashai, 40 ml decoction. Now we had given a bharad form of this Kashai and we had asked the patient to boil the Kashai and take the decoction because this has a deeper penetration level as compared to the ready quat which are available in the market. So Anupan was selected as Erandatel again with Vatahar action in mind. So once this deepen Pachan stage was ensured, only for moving the Shakhagat dosh to Kosh, we have introduced Sihanad Gugal in the dosage of 500 milligram BD. Next slide. Yes, now the doshas have moved from Shakha to Kosh and we now need to flush them out. So now we need something for Vatanuloman and here the drug is introduced is Erand-Brushed Haritaki in the dose of 250 to 500 milligram, which removes the Koshtaghat dosh out of the system through Vatanuloman. Other Vatanuloman in the form of Erandatel, again with the same intention of intensely moving out the dose from the Kosh. Yes. The Nasya which was initially given was Gud Shunti Nasya in Sama Avastha. And then only and only when we have been assured that the Sama Avastha has now turned to somewhere Pachyamana Avastha, we started with Shunti Ghee as Panarth. Now here the dose was not something with starting with 25 milligram or 30 milligram, but here in a very minimal dose, we started with Shunti Ghee, which has Ampachan property, as well as Grit, which will help in Agni Deepan. So this will do a dual work of Agni Deepan as well as Rasayan. As you might be aware, while doing home, we put Agni in the fire. Do we put a whole bowl of Agni or put it in a little spurts? The same action is expected here. We want to a good Pradip Agni. So for that, we add Shunthi ghee in a very minimal quantities. It will so that it doesn't cause any more more or sotorod, but it will cause only deepen of the Agni. Next, we selected Sahachar Tel Basti, only and only confirming that now the Avastha has been moved to Niram Avastha. The stools have been binded. Initially, the patient had urgency in stool. The consistency was semi-solid. So a little bit of Grahi Chikitsa was given, and then along with when the stools were binded, only then we went for this Basti Upakram, which has Vatahar and Vatanuloman property. Vaman was decided in this patient. Now the Chikitsa Sutra has mention of Virechan, but there is no mention of Vaman. In spite of that, we preferred Vaman was because the dosha in this patient typically showed more of Kapha and were more towards the Amashay. The doshas had Sanchiti more in the Amashay, so we preferred Vaman for this patient and not Virechan. Yeah. Next slide. Moving on to the next. So you see that there is lots of importance of Panchkarma in this Vatvyadi. Blindly following the Chikitsa Sutra, going for Snehan, Virechan would definitely worsen our case. But if we systematically see the condition of the patient, systematically move from Sam to Pachyaman to Niram, then this Panchakarma has wonderful effect in this patient. So after achieving the Niram stage, assessing the Bahudosh Avastha, only and only then this Panchakarma is advisable, as we saw that woman was introduced in this patient for Kaph being the Pradhan dosh and aiming at Kaph dosh, expelling that Kaph dosh out. So Nasya, we started with good Shunthi Nasya and Shunthi Pradhaman. When the Sama Avastha was controlled. Then Panchagavya ghee was started and Shunthi ghee Nasya was started for shaman purpose. And later on, for Bruhan Nasya, we can also give Shirbala 101 or Gogrut Nasya. Also, BG, that is buffalo ghee, can be given here as she had disturbances in sleep. So, this buffalo ghee acts wonderfully in pacifying the Niram Vata dosh and help the patient with getting a better sleep. Vaman, as we told earlier, basti in the form of Sahacharadi Tel Basti and Yog Basti. Even Tikta Shir Basti can be given here. We didn't prefer in this patient, but this the Basti also has a very good effect, but only in the Niram stage. And Rakta Mokshan can also be done in cases having severe pain. So all these treatment modalities can be given. Along with this, several upakram can help the patient, like Agni Karma and Vidya Karma in cases of extreme pain, where the patient has the pain scale more. Even Jalauka Aucharan can help in this condition. Now, there is something called block therapy, which we use in our clinic. Now, this therapy aims at releasing the fascia. Now, the fascia is like it is beneath our skin and it is all over the body. So, by releasing this fascia, we actually help the muscle spasm. We actually relieve the muscle spasm, and to some extent, it definitely helps the patient getting down the pain. So, this block therapy also gives us result in pain management. Yeah. Next slide. Dietary changes are important as we need to break the pathology in the disease. So in the initial phase, deciding whether to give Langhan or Lagu Ahar is very important. As I already mentioned earlier that if the patient is on steroid, you cannot opt for complete Langhan, but rather go for Lagu Ahar and then accordingly manage the condition. Or in cases where you see that Langhan, if the patient has very less appetite and just having food without any sensation of proper appetite, then in such cases, Langhan can give wonderful results. Once this Sama Avastha has been resolved, in the second phase, we can go for Bruhan Balya Mounds made Asti Poshya Ahar, which will help to give Balya to the Asti Dhatu. Yeah. Next slide. So these are the postural corrections which we mentioned earlier. So this consists of two phases, passive as well as active poses. So when the patient initially comes to us and if they are in more pain, we usually opt for passive pose where the patient just has to lie down and we give some alignment or some special posture which will help in relaxing the muscle. As you can see, the first picture is of slope bolster where the hip joint has been set in some an angle of about 45 degrees, which gives it a relaxing position. Next is 90-90, which also is a spine relaxant, and calf stretch. So all these three are passive poses which help to bring down the pain in the patient. Once the pain has been settled, and now where we want spine strengthening and increasing the spine mobility, we opt for Supta Ekpad Angushtasana, as you can see in this picture, which helps the stretching of the spinal muscles, and Supta Baddha Konasana, yeah, where the sacroiliac joint mobility is taken care of. So with these passive and active poses, we can definitely revert back the condition of severe pain as well as erosion. So timeline of the treatment, when we see, let's see how the patients came out of these symptoms. So 18th November 2018 was the day one when patient presented with a pain scale of about 8 to 9, morning stiffness of more than 1 hour and swelling. In next 10 days, when we gave mostly Langan Deepan Pachan, the pain had come to 7 on 8, but there was lot of reduction in the swelling. So here we can see that Am Pachan process had been initiated. In next 60 days, we almost see that the pain has been brought to almost 50%, and the morning stiffness has reduced to 10 minutes. So this you can see how the gradation of the pain has decreased, which gives us the boost that we are going on a correct track. After 9 months of treatment, we started enema somewhere in 10th of September 2019. So you can see after confirming that Sama Avastha has been completely eradicated, the stools have binded, only and only then we started with enema with Sahachar Basti. So this further helped to reduce the pain as well as the morning stiffness. Then somewhere after 2 years, the woman was done in this patient with Gurutvan, and 3 years, it has been almost 3 years and 7 months, this patient is out without any symptoms or relapse till date. So slowly and gradually all these symptoms came down. Morning stiffness almost disappeared. There was no swelling, and till date this patient has no active symptoms or relapse of this condition. Yeah. Next slide. Now, we have seen that ankylosing spondylitis has some relation with HLA-B27 gene, and this runs in families. So this disease has an hereditary manifestation, which was seen in this patient as well. Yeah, next slide. Can you move to the next slide? Yes. So ankylosing spondylitis has no specific cause, though genetic factors seem to be involved. People with gene HLA are at greater risk of developing this disease, and only some people with gene develop this condition. The hereditary condition was seen in this patient where she brought her son, where her son also got the same complaints of limping and pain in the spine. Yeah. So the next slide. So this is the case of her child, her son, 10-year-old, of the same patient who also developed a similar complaint of lower back pain and limping. So MRI and blood test of the child was done, and the HLA-B27 was positive, and MRI also showed the signs of erosion which were in a very initial stage, which were suggestive of ankylosing spondylitis. So there was a dilemma for the family now, like how and what to approach. But as her mother had been successfully treated and was out of this disease, they opted for Ayurvedic medicines. Next slide. Yeah. So according to the present day condition of the people, condition of the patient, I leave to you whether this disease can be termed as cured or remission. Now, according to modern science, they say that there is no cure for this disease. Only remission may occur, may last for years, months, or rest of the life. Now, in this patient, there is no active symptoms for more than 2 years. She is currently on not any medication, either Ayurvedic or allopathy, for this spine condition, and she is managing well with yoga, postural corrections, and block therapy. Regular nasya dietary changes, all which have been explained, are being followed, and she is completely out of any spinal mobility or pain as of now. Yeah. So in the conclusion slide, I just want to say um, that with what yeah, so I would like to conclude that the confidence with which I can present this case is that I'm at the receiving end of this case, that I was the patient here. I had got this disease. I was diagnosed with this disease, ankylosing spondylitis, and the treating doctors here were Dr. Devchan Gala sir and Dr. Hema ma'am. And with wonderful Ayurvedic drugs and stage-wise therapy, today I can say that I have been completely reverted back of this condition. So I would like you all to just have a note that are we ourselves ready to take such a challenge when we come across such challenging conditions like ankylosing spondylitis, which have been mentioned incurable in modern science, but definitely we have an answer by cure in Ayurveda. So this is all which I would like to say for today's session. Thank you very much for being a patient listener, and I may have hurriedly gone through some of the slides, and very sorry for if you have got some misconceptions. Yeah. Thank you so much.
It was a very nice session, Hetal ma'am. Do we have any questions for Hetal ma'am so we can put it in the chat box?
Uh, yeah. So first question which I can see is by Dr. Harshada, where she had asked for repetition of Faber's test. I think I had repeated at that time itself. Do you want me to repeat it again, Dr. Harshada? Yeah. Am I audible?
Yes, ma'am, you're audible.
Yeah. Now the chat. Can you just go through the questions as it is continuously scrolling on in my slides?
Okay, sure, no worries. Okay, so one of the doctors has asked how much Shnuthi Gruta given.
Yeah. So initially, when we started with Shunthi ghee, it was just a dip which was started, as there was lot of Agni Mandya and lot of Strotorod. So once little Samavastha was controlled for Agni Deepan and Rasayan action, just a dip of Shunthi ghee was started. Gradually, once the Agni Bal increased, and which was analyzed by the hunger time of the patient. Like when we usually tell the patient to have the ghee early morning and then wait for the next diet till actual hunger is initiated. So that time when it lessens, we see that Agni is being pradipted. And according to that, we decide the dose. When the dose between intake of ghee and the next meal is lesser, then we increase the dose. So initially, we started with just one dip of Shunthi ghee. And then, as and how the Agni Deepan progressed, the matra of the ghee was also increased. Yeah, next question.
Uh, when to start Brihan Nasya by
Yeah.
Dr. Sajjala Joshi.
Yes, so Nasya topic already Dr. Gala sir, Snehil sir, Hima ma'am, everyone has taken. So just a little brief. Initially, when we start with Shodhan Nasya, that is Shunthi Gi Nasya, and bring the Samavastha into control. Once the GS, that we give GS, and when the GS start coming down, that is in one drop, single drop, when the that single drop reaches to the skull, the passage is clear, only and only then we start with the Bruhan Nasya. For now, it will act on the Niram Vayu and give a Bruhan action there. Yeah.
Hello.
Yeah. Next question, please.
Okay, there is a request from Dr. Anju Chetia for explaining the block therapy.
Okay, so block therapy, I guess Dr. Hima ma'am would be in a very much better position to just give an elaboration on this block therapy.
Sure. So basically, block therapy is a therapy wherein we just use a regular yoga block, which is rounded, pretty rounded in curvature, and we use it at certain points where we find that the fascia has wounded up. So we use it at those particular points, and we try to unwind the fascia by focusing our breath. So initially we do a warm up with an abdominal breath, Once the abdominal breath has been activated, the diaphragm has been activated, so your whole body basically becomes much warmer. If we look at it into the perspective of Ayurveda, block therapy basically helps directly activating the Samanvayu, the Apanvayu, the Udanavayu, Vyanavayu, and even the Pranvayu. The access to Pranvayu is a little bit less, but rest of all the Vayus are immediately activated by using the block therapy. By the block therapy, what we do is whatever lean doshas are present in the system. For example, a person who is into a state who is not capable to consume ghee. And for that person, it's very difficult that we get out the lean doshas into the koshtam. So we have added this to the postural correction, that how do we get all these lean doshas from the shakha into the koshtam. So we are basically using a yoga brick. Probably we would conduct a small session on this also when time permits. Then maybe in one of the sessions we'll speak about block therapy. Block therapy has been a invention or a finding of a lady named as Diana Hansen. I don't want to just take it as a without mentioning her name. She's from Canada and she was trying to do her yoga instructor course for Iyengar yoga therapy. And at that point of time, when she had some sort of anxiety, she suddenly put her hand into her abdomen and she realized that how abdominal breathing is helpful. And using that abdominal breathing and her understanding about fascia, she developed this block therapy. I came across this block therapy by attending Dr. Shine Mohan's workshop. And then slowly we started incorporating it more into our uh, regular practice for postural correction, along with the other Iyengar yoga postural corrections that we give. So we use the block, place it at that particular place, and then we unwind the fascia by moving it and shearing it sideways or upwards and downwards. And we try to inflate that area. We try to create space in that area. We try to improve the blood circulation into that area. So basically, what we are doing is we are redirecting using the heat, the warmth of our breath, the blood circulation over there, doing the local dosh pachan over there, and then whatever dosha pachan happens, that is thrown from the shakha into the local blood circulation, and that local blood circulation gets it into the koshta. Once the vat or the vayu from that area brings in also the doshas from that area or that muscle, that srotas becomes free, and that is how we work on mobility of spine, mobility of muscle, uh, movement of tissues which have been displaced. That is how we used block therapy for Dr. Hetal.
Yeah. Thank you very much, Hima ma'am, for such elaborative explanation. Yes. Next question.
There's a question from Dr. Shubangi. At what stage is it safe to withdraw allopathic treatment?
Yeah. So if the patient is on any anti-inflammatory drugs or painkillers, so we can just convince the patient to go for Ruksha Swet, which will help tremendously help to come out of that pain condition, and so we can stop the NSIDs at that very moment. If the patient is on any steroidal or immunomodulatory drugs, then it is always better to bring the dose in the tapering format down. And for that, I would like we usually recommend the patient visiting the rheumatologist again, and only under the guidance of that rheumatologist, the dose can be tapered down if the patient has lesser symptoms. So I guess that would be the appropriate answer. Yeah.
There's a question from Dr. Pratibha, can you explain the action of Sinat Gugul, which you mentioned as dosha movement from Shakha to Koshta?
Yeah, so Sihanath Google has been mentioned in the specifically mentioned in the Chikitsa of Amvat, where this drug has eranditil, which is Vathar property. So once confirming that now the Koshtagot dosh have been handled, there has been arm pachin, and the coast has been cleared to some extent. Now we introduce drugs like Sihanad Google, which will go into deeper tissues, which have Mountsgat action and will help to remove the doshas from Shakha and redirect it to the coast. For if I would request Dr. Hima to guide on this more appropriately if needed.
Guide on what, Hetal?
Action of Sihanad Google as in this condition. Like if there is anything I have left in the explanation
No,
and
you have given an appropriate explanation. There's nothing to add. Basically, it will also work as a rasayan. CNR Google works in all the three stages. It will work in the Samavastha, Niramavastha, and later it also acts as a rasayan. It's there in the Falashruti itself
yeah.
of Sihanath Google.
Okay. Yeah. Thank you, ma'am. Yeah. Now, next question.
There's a question from Dr. Gala. Can erosion be reverted and can it be confirmed radiologically?
Yeah. So erosions can be reverted. Like if we compare symptomatically what pain it was before and now there is no pain at all. So definitely we can conclude that the inflammatory process has been stopped somewhere. And since the radiological investigation was not repeated later, um, I'm not very confident like whether what findings we would get now if we do an X-ray of LS spine. So, but definitely there is no pain, no stiffness, no swelling. All the movements of the spine are free and there is no rigidity or stiffness anywhere. So this definitely confirms that the inflammatory process, which was one of the main cause of this ankylosing spondylitis, has been addressed. And once the first stage only has cleared off, so there is no progression for the disease left. This is all if I can say for this question. Uh, I guess Dr. Devchan Gala sir has asked this question.
Uh, it is being from Dr. Gala itself.
Okay, fine. Yeah. Next
Uh,
question.
Question from Dr. Anju Chetia. If person is on Im and so
If the,
present, then
I'll
how to
take the
stop
question.
this?
I'll take that question. If the person
Yeah.
is on immunosuppressant, then how to stop those?
Yeah, so as I mentioned earlier, that if the patient is on immunosuppressants, they cannot be randomly stopped. They usually, the doses are tapered in these conditions, and it is always advisable to take the help of the attending rheumatologist. And only under his supervision, we can just taper off the dose and eventually and gradually we can stop. But at the same time, we should also assess the improvement of the patient and just check whether the inflammatory process has been addressed or not. Yeah, so Anju ma'am, if that answer pacifies you, yeah, you can move on to the next question.
Next question is from Jignasa Parikh. How to do the Deepan of Dhatwadani?
Okay. Yeah, again, if any Dr. Snehil or Dr. Hima, anyone can highlight on this point.
Please repeat the question.
How to make Deepan of Dhatwadani and Bhutadani?
If I think Dr. Gala is here, we can ask him to answer. I am a very small person to answer this. Sir,
Aarti, you have to allow Dr. Devchand Gala sir to unmute himself and if he can speak.
Yeah.
Okay,
I
I'll
would
just,
I
yes,
would
yes, just
request
give
if
me a
Dr.
second.
Gala sir is present, he can, enlighten more on this case as he was one of the treating doctors and give us more insights on this topic. So, Gala sir, please give us your valuable teachings.
Dr. Gala, sir, can you
Yeah, yeah,
check your
yeah,
mic? Yeah,
yeah,
thank you.
yeah. Can I talk now?
Yes, sir, you
Yeah.
can.
Thank you very much, Hetal. You have done a very wonderful job, and precisely you mentioned and explained everything in such a difficult topic, very difficult topic. And from a modern treatment point of view, there is no hope, no successful treatment available in a long run. And you have made it so simple in Ayurveda, and categorically you are so confident about treating these cases with the Ayurvedic medicines.
So, with all
Now,
your blessings.
it's a teamwork. It's not one person, it's a teamwork, and you are one of them. Now, answering your question, how to do Agni Pradipak karma at Dhatvagni level and Bhutagni level. Now, when you are treating any Samavastha by either Langan or by Lagu Bhojan or by any other method, Dhatvagni Pradipta is going to be there. Samavastha, as Samavastha comes down, Agni would get more and more enlightened. Now, after Dhatvagni, after Jatragni, it is automatically Dhatvagni Pradipta will happen, right? It is a sequence. You just cannot have straight answer to Dhatvagni Pradipta. Now, later part, how to improve the Bhutagni. Now, here you have already mentioned, you have already given the answer to how to improve the Bhutagni by giving Nasya. Initially, when Samavastha of the Bhutagni, that means nervous system, that means psychiatric problem, mental disorders, right? You have cleared off initially by giving either Sunti Prathaman or good Sunti Nasya. So that arm from the nervous system is controlled. And when patient comes into Niramavastha, then you are treating the patient with either Shaman Nasya or Bruhan Nasya. And that is how you can encourage Bhutagni. You can, the vitiation can be stopped and you can increase the control of the Bhutagni. So at mental level, patient feels very comfortable and very confident and very presentable. So once the Bhutagni is controlled, automatically body control becomes very easy. So mind over body would improve. So this is how I feel we can control Dhatvagni, Bhutagni, and of course Jatragni. Right? There, Nasya
Yes.
plays very important role. And then, of course, you have already mentioned, meditation and other yogic exercise. So that also will help Bhutagni and Dhatva and body also, right?
Yes.
So, in fact, for any kind of patient with any disease, we first treat the mind and then we treat the soma. So most of the diseases are psychosomatic in nature. So we first take care of the mind by giving Nasya Chikitsa, which is very simple, very effective. In very such a short span of time, you can get the result. You can control the mind. When patient becomes calm and cool and composed, automatically the bodily problem would get resolved easily with other medicines. So this is how Bhutagni can be controlled.
I would request Gala sir to take all the remaining questions for a very elaborate and appropriate answers. Yeah.
Sir, I would like to request you to elaborate on this question that you asked. Can erosion be reverted and can be confirmed radiologically?
Yes, yes. Now, my one request would be the person who has undergone, who has suffered ankylosing spondylitis for such a length of time and taken allopathic treatment and then switched over to Ayurvedic treatment with all modalities in Ayurveda. Patient has become almost all right since last 2 years. There was no relapse and no recurrence and no after effects of the disease. The one simple thing is to have one X-ray of lumbosacral spine with SI joint. If that is clear, then you can authentically tell that even radiologically you can confirm that erosion have reverted back to normal.
Yes.
Very simple X-ray, one simple plain X-ray. We don't need MRI to confirm. Just plain X-ray, lumbosacral spine with SI joint, right? So that
Yeah.
would confirm erosion which was there initially, and now you can confirm there is no erosion left. It is now healed completely. Inflammatory process has gone down completely. So there is clear-cut joint, SI joint on either side. So it's a big proof, very, very big proof. You can stand in front of uh, many doctors, all learned doctors, even in the hospitals or at a higher level. So one simple X-ray would confirm. That's what I feel.
Yes, sir. Yeah. Okay.
Sir, I would like to add something. In relation to the earlier question itself, this will answer this question. Like somebody asked for Dr. Jignasa, I think. She asked how to improve the Dhatwagni and Bhutagni. So once Jatharagni is corrected, Dhatavagni and Bhutagni also get corrected. So that will itself correct the Dhatu Pariposhan Kram. And once that Dhatu Pariposhan Kram gets corrected, I think those erosions will self-heal. They will start filling up. They will start healing up. So obviously in 3 years, definitely that Dhatu Pariposhan Kram has by and
No,
large improved.
I'm asking to confirm radiologically.
Yes. Yeah.
You,
Sir, but
you
that
can.
confirmation then can be explained uh, also like this way with the
I'm not saying clinically, but this is radiologically. So you can always present such cases in a large allopathic doctors meetings. And there is no doubt nobody can question your integrity.
correct.
Last question is any role of Mahavishagarbha oil that you have experienced?
I will answer that for Hetal because I remember giving her Mahavishagarbha Tel enemas, Matra Basti we had given her in cases when she had extreme pain, and that was Niram Avastha. So we had used Mahavishagarbha Tel, diluted in 30 ml of, and we had given her to take it when the pain was very high on scale, when she had excess work. In the Niramvat condition, Niram stage, when she would do her work and she would be exerted, there would be a lot of pain which would be unbearable. At that point of time, she had taken 3 or 4 times Mahavishkarbhati. So we had used that.
Yeah. Initially Sahacharadi, and then we had moved on to Mahavishgarbha oil in extreme pain conditions. So that was taken.
With no more questions left, I will request Aarti to conclude the session.
Yeah.
Okay.
One last thing I would like to add. Yeah. Can I proceed?
Yes, Hetal, ma'am, you can go
Yeah.
ahead.
I would also like I would also give Dr. Snehil Makwana a special thanks because all the slides which you have seen today, all the wonderful presentation which was available on your screen was all the efforts of Dr. Snehil Makwana. I was just the speaker reading out from the slides, but the main slide work, the beautiful presentation work was all done by Dr. Snehil. So big thanks to Snehil sir for giving me this beautiful slide presentation so that I could present my case so well. Thank you so much once again. And thanks to all the listeners for patiently being there in this meeting. Thank you, Gala sir. Thank you, Hima ma'am, for all your valuable inputs. Yeah, Aarti, you can proceed.
Hello, am I audible?
Yes. Voice is
Thank you so much, Dr. Hetal, for your insightful and enriching presentation. Your expertise and knowledge have undoubtedly provided us with a deeper understanding of how Ayurveda can offer solution for the topic. Once again, thank you to all the participants for joining us today. We look forward to see you in our next guest. Have a wonderful evening. Thank you, everyone, once again. We can end the
Mm.
session here now.
Good night, everyone.
Good night, ma'am. Good night.